A huge part of combating COVID-19 is delivering trustworthy information so people know how to protect themselves and those around them. This is especially hard in the sort of conflict-affected areas which HD works in. The conflict in the southern Philippines was one of Asia's bloodiest wars. Over the past decades, hundreds of thousands of people have fled violence and economic collapse to nearby Sabah. These refugees joined a large number of stateless, nomadic, and other marginalized migrants. Living in cramped conditions and without adequate access to healthcare, these vulnerable communities are at risk of contracting COVID-19. They urgently need information about how to prevent the spread of the pandemic. But that information needs to be delivered by a trusted messenger.
ANAK is a civil society organization based in Kota Kinabalu, and we believe in the fulfillment of basic rights for every child, regardless of background or documentation status. At the start of the pandemic, we were worried that the virus would spread among the migrant communities and that they would not know where to seek help. So we started using social media to spread relevant messages to them.
When HD first learnt about ANAK's work, we saw a real opportunity to amplify it and make sure it was reaching the maximum possible number of the marginalised migrant communities.
Since we started this partnership, we have produced materials that is needed for people to stop the spread of the pandemic. This included social distancing measures, signs of COVID, and also the importance of testing. These materials were produced in the 7 languages that the migrant community uses. We learned that in many communities, soap was not readily available. So after seeking expert advice, we made a short video about how to wash your hands without soap, and this turned out to be one of our most popular videos.
Social media allows us to direct public health messages at particular audiences. So throughout the campaign, we've directed the most important public health messages at communities in their native language. This maximises the impact of our work while minimising the space for misinformation.
Since we started this campaign, our public health materials have reached more than 300,000 people, and our videos have been viewed more than 100,000 times. We are now integrating our online campaign with our offline food distribution aid.
What we started supporting in Sabah, we're now doing around the world, from Nigeria to Yemen. Doing this work has taught us an enormous amount about how to harness social media for good in conflict-affected areas. And so once this crisis subsides, we're going to be putting that knowledge to use for dialogue and peace processes around the world.